Hi, today we're here with Chris Estle. Now, Chris is the Jefferson County Public Health Administrator. My name is Dick DeAngelis. I'm on behalf of Fairfield Media Center. Welcome. We want to get the scoop on what's happening with the COVID-19 in Jefferson County. And in order to do that, we are talking to the boss here. So Chris, thank you for being with us. Appreciate it.
Thank you, Dick, for having me again. I appreciate your time and all of the information that you provide to our community. So thank you very much.
Thanks. Well, a shout out to Jason Strong for all the great work he does. He edits this, puts it out for everybody. We really appreciate it.
We do.
So, well, we're in a little different time, aren't we, than we were just a week or two ago. And I think it was 7 cases that we had then. And now this morning, as of this morning, 35 cases.
35 cases. That is correct.
Maybe I'm looking at the screen on the side, if people see me glancing the side.
I am too.
Yeah, to also check out the latest and how many people have been, over 500 people have been tested. And the exciting news is that mostly those are people who might think they had something going on, right? And yet still, you know, a good 93-4% are testing negative. But there is, it's 6.5%. It's a fairly big jump, relatively speaking. Tell me what you know about what's going on with those numbers. I think everyone, you know, is concerned. Is it seniors? Is it people in a particular job situation? I know some of this is private, but maybe you could, I think everybody wants to know because we're also starting to come out and get active.
Right.
And we want to know, you know, is there a place to stay away from, a certain restaurant or anything like that?
Right, right. Well, first, my disclaimer is I'm going to apologize in advance if the phone rings because there's no way I can silence the phone. So it's been ringing a lot this morning, so maybe it's all done for a little bit. I don't know. So I apologize for that. So yes, here it is. I got to look at the calendar. It's the 4th of June today, which is hard to believe that it's already June. And we've been working on COVID-19 mitigation practices since the second week of January. So it has been a very long 2020. That's all I can say. It has been a very long year. And we have been sitting at 7 cases for quite some time. And as with any illness or any virus, once it's in a community, it takes a little bit of time for it to ramp up. So we see an increase in the numbers. And you're right, Dick, the more that we're out and about, the more exposure that we have to our community, our other people. We're traveling, we're doing different things because we're all tired of being at home. I get that. We're going to see an increase in numbers. And it's taken a little bit to kind of start the pot boiling, so to speak. So we're just kind of like seeing the first bubbles of that pot of water boiling. We haven't come to a rapid boil yet or to the peak yet. I anticipate an increase in numbers in the next couple of weeks here locally. And the thing that I want to stress is I'm looking at my other computer as well. I want to look at Wapello County since it's a contiguous county to us. Right now, there's 625 cases, confirmed cases, lab confirmed cases in Wapello County. That doesn't give us an accurate picture of how many people may actually be sick with the virus or how many people may be asymptomatic and aren't even tested. So I'm not telling people that they can't go someplace because we can't mitigate human behavior, but you have to make good choices about where you're going and what your exposure could potentially be. Right now, we don't have any, quote, hot pockets to really identify in the community. I know that becomes a struggle with people. They want to know who's got it, who's sick, how many businesses have this many cases. That is confidential information as far as the health department goes, but businesses and industry can always release that information on their own. We have been working with other counties, other communities as far as communicable disease follow-ups because we know people may work in Jefferson County, live in another county, live in Jefferson County, working in, we're so migrant with our jobs. So just because we're sitting at 35 cases lab confirmed doesn't really give you a picture of how many people are really sick. Does that make sense?
Well, I know you're not going to give it a guess, but what you're saying to me is we could have 100 people or 75 people or whatever, or even more,
Yes.
that just haven't been tested.
Right.
So
right.
that brings up actually another interesting question. We haven't, knock on wood, had any deaths
Correct.
so far.
Correct.
But out of the 35 people, can you tell us how many people are in the hospital?
I can say that I know Brian Hunger several weeks ago confirmed that the hospital here in town had taken care of 2 positive cases and that he was not going to release that information
Sure.
again. But I can say, as the public health administrator, we have had more than 2 individuals hospitalized. Now, that doesn't necessarily mean they've been hospitalized at our hospital, because not everybody, clinics here or it goes to the hospital here. We serve the public health looks at the entire county demographics. Yes. So we have individuals that go to other places for their care for whatever reason.
Okay, so actually that brings up another interesting question. I'm sure that you have. Are these people who live in Jefferson County, they may work in other counties, or are they people who just reported in Jefferson County, or what?
So that's a good point, and I try to clarify that all the time, and I think that gets to be confusing for people. And so if people have heard me say this, I'm sorry that I'm a broken record, but Jefferson County Public Health is responsible to do all of the communicable disease follow-ups for all residents in Jefferson County with a Jefferson County address.
Good.
So they could work in Wapello, Des Moines County, Van Buren County. They could be tested in any of those counties. But if their address is a Jefferson County address, then we as the local health department do the follow-up on all lab confirmed cases. That's true with COVID-19. It's true with pertussis, hepatitis A, any communicable disease. We are responsible to do that.
Right. So
I don't want to be.
That also means the opposite is true, which means that somebody could be working in an establishment that we frequent or whatever, and live in a home or wherever, and therefore not be included in those numbers.
That is 100% correct.
Okay. So just try to clear it up so that we know what we're talking about. I know that, especially on Facebook and stuff, there's all kinds of misinformation. And I know that it's people attempting to try to get the right information. They might hear it from somebody they think is accurate. Sticking up. So I guess while we're on it, let's just ask you, I want to ask you a couple other things, and then we'll go into, if you test, let's say I was tested. So I kind of.
I was too.
Honest
I
disclosure.
was too.
I went to Ottumwa through the drive-in, and it isn't a pleasant experience.
No,
but it's not the end of the world either. No,
right.
Nobody should not do it because it's unpleasant. It just, is like, wow, that was not fun.
Right.
Forget it. So I was thinking it's a little bit better than this, but not as good as this. But I won't go into it. I just want to just say it came up negative for me.
Me too.
Which I was very happy about, but at the same time, that only means that moment in time a week ago, I was negative. So as I approach people, talk to people or whatever, we are developing, we're shooting a film, as you know, and we're developing our own protocol for how to, interview somebody. Somebody has to maybe put makeup on a person, et cetera. And there are resources at the state level for recommendations on how even a film company should operate in the state of Iowa. So if it's for that, I'm sure there's other really good resources. So please, I think everybody should take advantage of it. I know everyone has different sensitivities to this. Some people are a little bit more, you're going to get it, you're going to get it. I get that. And to some degree, I think that may be true. I mean, the reality is this thing has been coming, And we've kind of been seeing it from afar and saying, well, is it going to come or is it going to disappear by the summertime or what's going to happen?
Right.
And I think the more we research, tell me if this is right. It looks like at some point it's going to, have to kind of come into the population and people have to either deal with it or there's a vaccine, kind of whatever comes first. So that there's antibodies that come up. So I guess what I'm interested in is because I had it through my head, okay, what if I do test positive? What do I do? And how about if I'm feeling pretty good? Like I'm exercising each day, believe it or not, on my bike or whatever. And would I continue doing that? And I'm thinking in my brain, yeah, I'm going to continue doing all the things that try to make me as healthy as possible. I guess unless I had a really bad fever or something. But, what if you do test positive? Are there things you can do at home? Because I guess they're not recommending people immediately go to the hospital, right?
Right.
So can you go over that? Like, what do you do if you do test positive, I guess?
Sure. So, and just, I mean, I'm no different than anybody else just because I happen to be the public health administrator. I have my own personal life. I have my own family, my own friends. I might have 2 friends. Maybe by the time this is over, I might not have any friends, but that's okay. And I was exposed to an asymptomatic individual. And this individual went and got tested because they wanted to know, they wanted to know. So then their test came back positive. And I had, at that time, the criteria was extended exposure was anything greater than 30 minutes. Well, now the CDC has changed that. So it's anything greater than 15 minutes, closer than 6 feet together. Well, as it turned out, it was that way. So I went and got tested at Test Iowa in Ottumwa. And, how they had the system set up, it was great. You go online, you take the assessment, you answer the questions, you go over to Ottumwa, you drive through, you have your license, you have your little QRS code or whatever that's called. They drive you through, you get swabbed, you go on your way. The one thing that I personally was frustrated with, and I've made this known to everybody that I can tell, meaning the State Hygienic Lab, Test Iowa, one of the deputy directors at the state health department, there was a lag in testing results. So, in me receiving my results. And that's very frustrating. Number 1, as a human. Number 2, as a public health administrator. Number 3, as a nurse. And I know how this is supposed to really work. And on behalf of all the individuals that maybe don't speak English as their primary language, maybe don't understand the system and how it's supposed to work. And when Test Iowa says you're going to get your results within 72 hours and that doesn't happen, that's very frustrating. So on behalf of an advocacy for everyone, I took it to where I could take it. And, the thing I want to stress is this is not an Iowa Department of Public Health program. This is under the auspices of the governor's office. So if anybody has any complaints or concerns or questions about Test Iowa, those need to go directly to Governor Reynolds' office, not the Iowa Department of Public Health. So
I was going to give them your address. No, I'm just kidding.
No, thank you.
Hey, Chris, actually, I have some news. Looks like someone's joining us.
Okay.
On the call. So I want to just take 1 second. We've been joined in our conversation by Jefferson County Emergency Management Coordinator. Actually, is it Jefferson County?
Oh, it's Jefferson County.
Yeah, and it's Brett Ferrel's joined us. Brett's had a very easy morning from what I could hear. He's had a tough day already, and it's only 10:30. But thanks a lot for taking the time to join us, Brett. We really appreciate it.
Yep.
We're kind of Chris was telling us a little bit about her experience and how frustrating it can be when the results don't come back when you want. By the way, mine came back a little more than 72 hours, Chris. So there is good news that.
Mine was a week.
Wow.
Mine was 48 hours.
Wow, you know somebody.
Yeah.
Hey, well, Brett, I guess we want to include you in on this. We've been talking a little bit about the jump in case counts to 35 in Jefferson County. We've been trying to dig into those numbers, but Chris has been duly evasive. No, I'm just kidding. There's only so much you can say, and we understand that due to privacy considerations, et cetera.
Yeah.
But we have been going into a little bit now into if you test positive, since some people are doing that now, 35 right now out of the 540 that were tested so far in Jefferson County. What do? You don't go necessarily right to the hospital. So what can you do at home to possibly even mitigate some of the possible conditions you might experience from this?
Right. Well, it depends on your work environment and what you do for a living, because there's different guidelines and recommendations depending on if your job is considered or your profession's considered essential. I was asymptomatic. I had no symptoms. I felt 100% fine. I was able to come to work. I wore a mask when I was around individuals. We monitor temperatures and pulse oximetries here at the health department for anyone that comes in. And so I was able to do my job responsibility as normal. Now, I did not go any place. I didn't have contact with anybody. And those are the things that we need to stress to people. Even though I was asymptomatic, I still could have been potentially positive. So you still have to take into account what, I need to wear a mask. I need to stay home. I need to monitor what I'm doing. Those are key things. And those are the things that we struggle with in public health, because if you're feeling okay, you just want to go and do whatever you want to do. I get that as a human. I get that. So it depends on what you do for a job. It depends on, how many people are in your household. If anybody in your household has underlying health conditions, you want to take those things into account as well. And we can go through that guidance, or I tell individuals to go to the coronavirus.iowa.gov website, because it's got tons of great information in easy to read format. Most of that's easy to read. And while you're waiting on your results, Test Iowa doesn't really give you a lot of information. They give you information after the fact. But again, it depends on your profession and what's going on, and if you're symptomatic or asymptomatic. But to answer the question, Dick, the healthcare center, Jefferson County Healthcare Center, still has their COVID clinic open. They don't call it the COVID clinic, but it's a specialized area for people that have respiratory problems. So there's a little bit heightened area of, not necessarily restriction, but a higher acuity level of patient care and triage. So you might be treated a little bit differently based on your symptoms and what could be going on. They still have that available. Basically, it's like any other virus. 80% of the population is going to be okay. And when it gets down to it, like 5% of the population is going to have complications. So we just treat the symptoms. If you're feeling okay, go about your life, stay home if you need to stay home, if you're asked to stay home, clean out your closet, do whatever, do your exercise on your bike, live your life. If you develop symptoms, nausea, vomiting, loss of smell, loss of taste, fever, cough, headaches, then you should probably be seen if you can't manage those symptoms at home. And again, we encourage you to call the COVID number at the clinic. Let's see, I think it's 469-4180, I believe is the number. And also too, if you need a higher level of care and you need to go to the emergency department, you can go to the emergency department for treatment. They just ask that you call the number on the door, or before you go in, let them know that you're coming in and you have symptoms. They do have screeners there when you walk into the emergency department, and then they get you triaged and get you where you need to go.
Okay, great.
Does that make sense?
Yes. No.
Okay. That was a long answer.
No, I appreciate it. I think that people are just, as there are more positive cases, you're starting to get to the point where everybody's starting to know at least somebody who either thinks they have it or have already been tested positive. Mm-hmm. And when you do that, all of a sudden now you're starting to think, okay, well, I did see that person, but I stayed more than 6 feet away, or I had a mask on, or, we didn't hug each other and,
drink out of the same bottle, right, or whatever. Yeah.
Right. So do I have to worry? I mean, and I think that people are just wanting to make sure they do the right thing for themselves, their family, and their friends, and possibly people that they're at work. So
Right.
I want to at least give people some real practical things that they need to do. And I don't know if it's still this way, but it's become more available for people to get tested if they're really concerned, right? Do you want to go over that real quickly?
Yes, I will. And then, so Test Iowa is still in Ottumwa. Test Iowa is opening up a clinic at Great River. The numbers are on the Test Iowa website. The State Hygienic Lab has changed their criteria for testing. So now if I would have been exposed to someone, I automatically meet criteria for State Hygienic Lab testing because I am a healthcare worker. So
Right.
that continues to change. Reference labs such as LabCorp are running tests. So testing is more accessible. It's the reagent, usually, I'm not a lab tech or a lab manager, but it's the reagent in which they need to run the tests oftentimes is what's in short supply. The actual swabs that they stick up your nose, which is pleasant, are, people have access to them. It's running the actual test where we run into a supply issue. And, we've been dealing with this now for several months, so supplies are starting to catch up. You're going to see more and more options. Right now, our local health center is not offering testing per se. I know that's something that they're looking at. I know that I've talked to Brett and I talked to Stacy Worley yesterday, the emergency department manager, and they're moving forward with what they need to do internally. I can't speak on their behalf, but I know that that's an option. We've heard Brian Hunger reference that previously. So, but again,
Any news about that, Brett? I mean, in terms of testing going on locally that you know of?
Yeah, I leave that up to the public health and the hospital to
Okay.
and resources.
We thought
He
maybe
is-
you had some direct connection since you got your results in 48 hours.
But no.
Okay. Well,
I didn't-
speaking about testing, Chris, is there any change in this whole antibody test?
There is, and I will say there'll be more information coming on that. And basically what antibody testing is, it's a serum, it's a blood test, so they have to draw blood.
Right.
It's not a finger poke yet, they actually have to draw blood. And they spin it down and do all their little magic in the lab. And then they test your blood to see if you've developed antibodies to this COVID-19. It's the same, it's similar with any, if you have a needle stick for hepatitis B or whatever the case may be. So it's to see if your body has developed resistance to that virus that it was exposed to. I know that the state, we had a webinar yesterday. I know the state is working with Iowa State Veterinary School at Iowa State University to do some serologic testing. That information will be coming soon. I know that that's something that can be drawn and sent out, but you have to have enough exposure to something to
Right.
develop antibodies, and then that's how we develop herd immunity, meaning the greater good. All of us have been exposed to it. All of us have the ability to fight it because we've been exposed to that. Does that make sense?
Yes, no, great. Hey,
Okay.
Brett, we want to bring you in on this.
Yes,
Can
we
you
do.
Can you give us an update from your side on things and let us know kind of where we stand right now?
Well, I think you guys already talked about it. I mean, the cases will continue to go up because it's community spread. And obviously there's more testing being done. When we originally started this, we didn't have very many tests, and they weren't running a lot of tests because people didn't meet the qualifications, so our numbers stayed fairly low. And we're preparing on a day-to-day basis, just like we were at the beginning, for what might happen in the future. We don't spend as much time in our emergency operations center like we did for the first 2.5 months. Probably we were in there on a daily basis. The first month we were in there every weekend working nonstop, and so we still have plans in place for worst case scenarios and outcomes. But the cases are going to continue to go up until, obviously, until they eventually find a vaccine or something for it. We're going to be dealing with it for a while, and the more testing that's being done, Test Iowa being offered, and people from here driving over there, people wanting to get out. It's summertime, go to the lake, do stuff, and you know, I'm not against, you know, the free do what they want to, but you know, I'm very cautious and when I go out and do things. You know, we have hand sanitizer. I have one in every vehicle. Make sure my family, all my kids, you know, I got a lot of those driving around now, so you know, they get sanitizer. Make sure they just follow simple rules and try to protect themselves because people are going to be out and about. But as far as the emergency management side goes, you know, we've always been a resource for public health in this national emergency, and we continue to do that. But we are sitting good right now as far as a county for personal protective equipment and the plans that are in place moving forward. And, you know, unfortunately, as much time as this has taken all of us, you know, like I said, we spent a lot of time together, sleepless nights, a lot of stuff trying to get this to where our county was ahead of the game. And I think we did a really good job there with all the partners involved. And unfortunately, you know, we all have day-to-day jobs. And, you know, like I said, I just got a notice on my phone, severe weather, you know, severe weather season. And I'm very involved with keeping our community safe during severe weather. We're getting updates on the protesting and stuff like that. So it's a never-ending battle with what's going on in the world right now. And as long as people continue to try to do what they're supposed to do on the COVID side of it, and just follow the guidelines, it'll make everybody's job a lot easier in the long run.
Well, thanks. You know, we always kid around with you and say, hey, Brett, smile a little more, but we had your job. I don't know, maybe we wouldn't be smiling as much. I mean, you're preparing us for the worst sometimes, and we really appreciate the work you do and your whole group out there. And thank you. The emergency management people are kind of unsung heroes in some ways, right? You know, because you don't really ever want to see them, but they're always working for us to prepare. So
most people don't know that there are emergency management coordinators out there. And you know, I came from a fire background. I've been in the fire department for 20 years, and that kind of led me a lot into what I do here with this job. Emergency management is a great resource for communities, but there's a lot of planning involved. Every day that we plan and exercise and do things, but we have great community and state partners on that side of it too that really help us out here in Jefferson County if things were to go bad.
We do, and you know, Brett he just celebrated 5 years, right, as our emergency management coordinator for Jefferson County. And I've been in this position for 12 years as public health administrator. And Brett's exactly right. We're not only dealing with COVID-19, but we're dealing, you know, health department's dealing with other communicable diseases. We started doing home care this week. Next week, we're going to start doing immunizations. You know, there's other things that we're doing on top of COVID-19, but all of the other activities or things that we're doing are directly related to COVID-19 mitigation. Okay, I'm going to bring this up because, you know, Brett referenced it. We all know that the horrific incident that happened with the murder and death of our individual that, you know, I don't want to get into a hot political discussion, but what happened was wrong. I mean, black, white, yellow, green, purple, it doesn't matter.
In Minneapolis.
Yes.
Yes.
Yes. I, as a public health nurse, as a former ER nurse, I'm really struggling with this whole situation. It's just unsettling to me.
I don't think anybody could watch what happened and feel a whole lot, not only for George Floyd and his family, but just really kind of, I was reading today the words of Kirk Ferentz and him saying, you know, we're all, he's 64, so am I. We're all learning, you know what I mean? We're all learning and maybe our understandings from 10 years ago or whatever have to change, and we have to be open to that change. So I appreciate that, and your sentiments. There's a lot of people that were really shaken up by that incident, and in some ways, and I know it sounds awful, but if it brings a little good and change to it, then maybe there's some value in what happened certainly not a good thing, but certainly
Right.
a thing that we can learn from. And so thank you for saying that. And I
It's
definitely
tough.
do feel it's affected the health of
Oh,
our country and our county too, you know. And
absolutely. And
so,
what I wanted to say before I got all emotional and lost it,
yeah,
Jason can edit that part out. Anyway, what I was gonna say, as a nurse, you do not you take care of everybody. You don't ask their religious beliefs. You don't ask what political party they belong to. You do know what color someone's skin is because you're doing an assessment and you can visualize and see that, but you treat everyone the same. It doesn't matter. And so when we see senseless acts and death and murders and all sorts of bad things happen to all individuals, I just struggle with it. And, I was born in the 60s, and it's like, I don't really remember all that because I was born in 63. So, but it's like, can we not move forward? Can we not come together? Can we not understand the importance of working together and listening to people? And not only for health and wellness, but for safety, for equality, for every other thing as a human being. And people don't want to talk about it. They don't want to say his name. They don't want to say George Floyd. They don't, I have friends that are cops, friends that are deputies. They have a difficult job. And I'm not making any excuses for anybody's actions, because at the end of the day, we're all responsible for our own actions. But those actions directly impact Brett's job and my job, because we're going to see another increase in COVID-19 related to protesting. People are not wearing masks. People are not social distancing. So in addition to the tragedy of that whole situation, we're going to see an increase in other issues related to complications because of this virus that's spreading. That's my soapbox. Sorry.
one thing I want to make sure that we answer, that was, you had that question. Is that you, Chris?
Yeah, it's my phone. It's okay. It's okay.
Is-
I'm ignoring
Is
it.
about this antibody test.
Yeah.
You said something, is a possibility that it may become more available to people?
It will become more available to people. And I know yesterday, I'm sorry, I think I got off topic, but
That's all right.
I do know that information's coming. I don't have it yet, but I know that ISU and the Iowa Department of Public Health and the State Hygienic Lab are working on serology testing. So there'll be more information coming. I know that you can have blood drawn and have it ran and have it tested. But again, you have to have been exposed to it, and your body's had to have time to build the antibodies.
Correct.
So it'll show positive that you have antibodies.
And then you have to make sure that the testing's accurate, because that testing so far has been notoriously iffy.
Right. And then there's that whole topic of people don't want to believe, people don't understand. I'm not a lab tech, I'm just a nurse.
Well, I think that the reality is this: whatever the testing can give us, it gives us the most accurate results we can get at this time.
At this point in time,
Right.
the testing has to be validated, meaning they do a blind study, they run certain tests again, other certain tests, so many positives, so many negatives, so they're comparing to make sure a new piece of equipment or a new test is running appropriately. I mean,
Right.
there's so much stuff that goes into the backside of this. Our labs and our lab techs are unsung heroes, because they've been working their buns off pushing stuff.
The reality is, in this time, it seems to me, I don't know. I know there are some people who are really doing heroic work.
There
People
are.
working with, our healthcare professionals, et cetera. The work that you two guys are doing, we really appreciate it. I told you that last time we met, and I'll tell you again. But a person who's working at the restaurant that we pick up food from, or at Hy-Vee, or somewhere else, they're important people in our whole picture of things.
They are very important people. They are essential workers. Brett and I have kids, we all have kids that are working. Our meat processing plant workers, they are essential workers. They have a difficult job. Everybody that's on the front lines, that's getting us food, shelter, clothing. If you look at the hierarchy of needs, all the way back to when you took probably your very first psychology class, the hierarchy of needs, food, shelter,
Right.
safety, that's
Right.
it. And we have to think about the risks that we are putting other individuals in. I finally got a haircut. Yay. So, my stylist had on a mask. I had on a mask. People that work in places don't have an option. They're doing their jobs. So we as customers need to make sure that people can remain as healthy as possible. It's our responsibility to help them. And sometimes we become very selfish and very self-focused on, well, I don't have to do that.
I think people just become frustrated.
Well, I'm frustrated.
Sitting at home and they're just feeling like, but there are things you can do. You can take your family out to, especially out here, there's a lot of remote areas that are beautiful. You can be out in nature and not be anywhere near other people. And enjoy that and be with family. And so there's certainly the opportunity. I know Karen and I checked out every Jefferson County park. We just took a ride every Saturday and just said, we got to get out.
Yes.
And we just went and looked at it. If there were any people nearby, we kind of went to a place where there were no people. Yeah. And other than the Lee Gobble Park, which is in Abington, which is like a postage stamp,
It is.
Fortunately, there were no people there, but there was plenty of room. So I would just encourage people, to find ways to do things where they can be active and out in the sunshine, because it does seem to be a better situation when you get out in the sun, right? I mean, if you're not with a lot of people, we are fortunately not in New York or New Jersey, where they go out on the beach and, there's a lot of people wanting to be on the beach,
Right. We're very lucky. We're very lucky. I know Brett and I talked about this the other day about the importance of taking care of yourself, getting outside, doing something fun, being with, a small group of friends or family, because believe me, it's been a long haul since January.
Yes.
And everybody's getting a little grumpy. And
I work in an office all the time. I went out on my tricycle last night and it was hot. It was hot yesterday. And I'm a big guy, so you have to be a little careful when it gets real hot. I don't want to, put my health at risk. But you know what? I said, I'm only going to go, instead of 1.5 miles, I'll go as far as I go when I'm saying, okay, I better get back. It ended up being about 1 mile that I took a little bike ride. I came home, I was sweaty and so on, but I felt so much better having to get out there and do a little something, get a little movement, because I'm in the office and all of a sudden you find yourself, I've only been out and about a little bit and I've been editing film or whatever I'm doing. So I just encourage everybody, if this big lug can get out there, just get out there and do something. It doesn't have to be a lot, and you'll feel better, because I see a lot of even young people with a lot of emotional challenges right now, and their attitude is in the dumps, and it some of that has to do with just eating good food and doing some good exercise and getting some good sleep. I mean, I know that sounds so basic, but anyway.
No, it's very true. And try to not watch the news and 24/7.
Limit your news exposure.
You can watch it, but it does consume you. And you saw that I got upset about something, and it's like, my gosh, we've got so many other things going on.
They play it again and again. And for those of us who were here around 9/11, they played it again and again and again. It really did, you're hurting just by watching. Yeah. And yes, you don't want to forget it. And yes, you definitely want to face it and be honest in it, but you also don't want to see it 1,000 times. So,
and we have to make changes. So,
Brett, do you have any things you want to share with people in general, like just things that they should know you're doing, or things that they should start doing, or ways that they could help in the effort in some way?
Well, like I said before, just do your job as a citizen to help slow down the community spread. But yeah, you guys talked about going outside. I would say if you go outside and you plan a day at the park, or you're going to check your weather forecast first. That's my little plug. People get hot out in severe storms when they don't watch that. But no, I would just, I've said this before, we're lucky we live in the community we do. A lot of people are stuck on Fairfield and what we're doing in Fairfield, but really, you know, it's a county thing. And over the years, I've been blessed to work with, you know, we have first responder groups all over the county. We have great fire departments, you know, Batavia, Louisville, Packwood, Lockridge, they've all got great people out there that are taking care of their communities, their mayors and their city clerks. So, you know, when you expand it out, it's people get stuck on the Fairfield thing sometime, and it's countywide that we put out the information countywide, not just in Fairfield. And those people do a terrific job in those cities and their jurisdictions of making sure that they're putting out the information, and we will continue to do that. But, you know, the business owners, you talked about the heroes, the frontline workers, we work with those every day, and they are true heroes for what they do. But you also have all the citizens that we care about. The business owners have done a great job. You know, they got stuff that have been put in place on how to keep their employees safe, that they have completely changed how they do business. And I applaud all those people for doing what they've done to keep their workers safe and the workers that go in there. So it's a community effort, and we're lucky we live in this community with everybody. I grew up here. I've lived here all my life and raised a family here. And I truly think that the citizens, you know, the people continue to do what they're supposed to be doing, and you know, our essential workers and frontline workers and businesses will keep doing what they're supposed to do. And in the long run, I feel a lot better about living in Jefferson County than some people probably do across the nation. Makes our job,
excuse me?
Makes our job easier.
Yeah, true.
Yeah.
Thank you for saying that. I'm going to put a little plug in for our local businesses. You know, these businesses, you could see it on the square. There's a few of them who might not have made it through this time. I think it's really important for every one of us, if you possibly can, make an extra effort to purchase anything that you need to purchase through your local businesses and keep our communities businesses strong, because they're working really hard to stay in business, get through this, and then be here for us, so we have a thriving town. And when this is all over, and I think that we can do something, and that is, I'm not trying to hurt the billionaires that own Amazon or anything, but you know,
They could take a little hit. They could take a big hit.
bring it. Yeah, I'm sure our postal workers will be fine without delivering one extra package and making sure that we can get it from local businesses. They have great drop-offs. I just purchased something someplace. I put it on. I ordered it on the website. It was waiting for me at their back door, where there's a simple pickup. Nice and easy way to do it. There's delivery services for food for people, for certain restaurants, and or you can go pick it up, maybe get exposed to a restaurant that you hadn't been exposed to. So better to expose yourself to our restaurants than to the coronavirus.
Right. And I will say that Brett and I, and we met with Terry Baker, I can't remember, was that I think it was last week. And, you know, she was working hard. You know, it's a fine balance between health and safety, staying in business, having what we needed as a community. So it's, you know, we all have to eat, sleep, access to healthcare, safety. It's a challenge. It's a challenge. That's why we, and Brett said, we're thankful and appreciative of everybody that's trying to keep everybody else safe. We need our workers. We need our workers.
Yes. So to finish up, I just want to say, if somebody feels like they've been exposed to the coronavirus or they're having certain symptoms, what website do they go to for actually the testing to get in, you know, to answer some questions and possibly sign up to get tested?
They can go to, for testing, it's Test Iowa. They just Google Test Iowa. It's the easiest thing. And it'll bring up the schedule of where the Test Iowa sites are.
And right now, the closest one is...
It's Ottumwa, but they moved.
Oh, they did move.
It's at Evans Middle School. They moved from the beach.
Oh, okay, good.
Yeah. And then
they one of the last ones at the beach.
Yeah, they probably want to get ready to open the beach, hopefully.
Yeah, oh yeah, that's interesting.
So, and then there's also one at, in Burlington, I believe it's at Great River Medical Center, and I don't know that it's a site like a Ottumwa, so just call the number or fill out the assessment. And then the best website to go to is, I just want to make sure I got it right, coronavirus.iowa.gov. And that brings up the maps, it brings up information, it brings up the governor's proclamations.
The nice thing is if you click on Jefferson County in the map, then all the numbers up top switch to Jefferson County numbers. So you really do get all the information you'd want to know, and it's all updated. So I highly recommend that people make use of that information, and get off of Facebook a little and hearing other people's rumors about whatever the numbers are, and actually find out directly what they are so that you know, and you can keep, if that's interesting to you. I do think that it's obvious there's been a switch. We've been at 7 for a long time. We're at 35.
Yeah.
I think that it's common understanding that that number is going to go up.
It will.
And that's okay, and that everybody just should take care of their health, take care of their neighbor by not exposing them unnecessarily to this virus, so that if it does expand, it expands in a slow way so that our community develops this herd immunity eventually. And that's the word here. Anything, last things you guys want to say?
Well, I mean, you talked about so it slows the spread. That was the goal at the beginning. We knew it was coming, and we didn't have a case for a while, but we knew it was coming. And they always said flatten that curve. We don't really like that term, but that's what everybody says. But it was still not to overwhelm the health care systems in the state and in the county. So we're in good shape there. But, you know, if everybody does what they're supposed to do, we're going to get more cases, but we got good plans in place.
Well, it's certainly a lot better to be near the end of that. So now that we are better prepared, and I hear that's what you're saying, if this number did increase, we've got the equipment, we've got the facilities and the personnel ready to handle whatever would be handled. In the meantime, if someone does test positive, that doesn't mean they have to run to the hospital. They should monitor their health symptoms, and then if they get to be excessive in some way, then, you know, and keep in touch, obviously, with your doctor or your health professional, just so that they know what happens and what you've happened. I think that would be my suggestion, at least, to let your doctor know if you do test that way, just so that they are aware of what's happening with you. Yep. And I appreciate you guys taking the time with us. Any last comments?
No, thank you guys. I just want to thank you guys and the Fairfield Media Center for getting the word out. We appreciate all the work that you do, and it's so important to have great relationships with the news media to get factual information delivered to the masses.
Well, I appreciate you guys, and also our mayor and our city council and our county supervisors for keeping the lines of communication open. We'll talk again, but thanks a lot for taking the time today.
Thank you, Dick. Thanks, Brett.
Thanks.
Thanks, Jason.